Nice to have you, yeah, from everywhere across the globe. So today we are just going to have to look at our Horizon 2050, which is a document we did like 3 months ago. And the reason for this document is because we wanted to look at the changes which are happening in our healthcare systems and the impact it's having on the business models that we have currently. And the onset of these changes, we look at it from the coming in of COVID, because COVID is what really awakened the healthcare systems, and it made us aware of what is happening. So just a minute, I will share with you my screen so that I take you through my slides. Something doesn't work. Okay. Okay, here we are. Horizon. So here we are going to just have a quick discussion about Horizon 2050. If you have any questions, please share in our description box. We can discuss about it later. So we are going to look at some of the things that have pushed our healthcare system to change. And as I said before, the Horizon 20, the coming of COVID had a great impact on our healthcare system. It is during the peak of COVID that we realized how much our healthcare system is ailing and how much our health workers are pushed beyond their limits. We have so many health workers, but at this point, the system could just could not cope with the situation we had at that time. And this is clear that if we ever, because this will not be the end of the pandemic, we expect other things will come up in the future. So definitely this will continue to be the case. And if we don't do anything about it, it will get worse, because with the increase in population, age, as in demographic changes, we are getting older, we are getting more sick. So that means if we have an ailing healthcare system which is not well staffed, we are not able to cope with all this pressure. We are also able to see that if the stakeholders or the legislators do not make changes or advocate for change in the healthcare system, the healthcare system is not able to adjust, or they're not making any investment towards improving the situation in our healthcare system. So coupled with other things that include cost of healthcare, we see that things must change. And how are they going to change? And what happens if these things do not change? So when we look at a pandemic as a catalyst, it leads us to 3 scenarios which are possible or which can happen as an impact of the things that have happened in the recent past. One is that there must be some changes economically. How do we fund our healthcare system? How are the governments supporting the public to get healthcare? What initiatives are the people taking themselves to be able to get healthcare? And that, how is the digital transformation that we are experiencing now or in the last few years affecting our healthcare system? So these are the 3 scenarios which are affecting our healthcare system. And we are going to look at these scenarios briefly just to have an overview of the impact of these three scenarios. As we look at the limits of what is economically visible, we see that our healthcare system do not have the capacities to support the population in case of any eventualities that may happen in the world at any one time. May it be a small eventuality or huge, like COVID, which impacted us globally. And maybe in another 4, 5, 10 years, we'll have another pandemic. So what will happen? So this greatly impacts on our healthcare workers. So we need to think about these things, how these things will affect our healthcare workers and how will they be able to deliver a service and what will be the quality of the service that the people are going to receive. Another thing is that we see that especially in the developing countries who are most affected by this, maybe the COVID-19 or other outbreaks that happen suddenly or other changes that happen in our healthcare system. One, because we know that in the third world or in the developing countries, the healthcare workers are not enough for the population. We do not have enough facilities. They do not have enough funding to be able to care for the population. And in these scenarios, we see that they get a lot of funding, maybe in terms of loans or in terms of just gift gestures from other governments, especially from the West. So we see these things are affecting our healthcare system. And another thing that is also important in our healthcare system is insurance. How does insurance support us as a population to be able to get the healthcare that we need? We see in some countries, for example, the US has a two-tier system. We have whereby the government has some support, and we see where the payers have to pay out of their pocket to be able to get the services that they need. That means if you do not have money or you do not have any insurance, you are not able to get the service you desperately need. And in these scenarios, this leaves out the people who are most vulnerable in our health, in our society, because we see if they are not able to get treatment simply because we do not have insurance, that means a lot of people will be affected. Maybe they will have a death which would have been prevented, or their conditions will advance to a level where it's too late to be able to get the healthcare service that we needed. So we see that insurance is playing a very big role in our healthcare system, and it is an industry which also needs to evolve as our healthcare system continues to evolve, which is something I will look at it in more details in later stage of this webinar. Number two, we see that the funding that is coming into the healthcare system or into our healthcare keeps increasing every year, and expenditure per capita also keeps increasing. And we see that the US has the highest per capita expenditure. According to the data I have in 2019, it had the highest expenditure. And we see people are continuing to spend more to be able to get healthcare, and the governments are also continuing to spend more. So the question is, does digitization of the healthcare system improve this expenditure in healthcare? Are there going to be any benefits if we have a system, as we are seeing now, things are moving from analog to highly digitized healthcare system? Will it have an impact also on the quality of healthcare that we receive? Will it also have an impact on being able to reach a larger population? For example, people in rural areas where we don't have so many doctors or nurses or any other healthcare workers. So those are the things we should be looking at as an industry, as a people interested in the healthcare system, or investors in the healthcare system, or service providers in the healthcare system, because being able to fund healthcare is so important. And we cannot only rely on governments to continue funding the healthcare system. We have the private sector and we have other investors. And we see that digitization is changing this and allowing in much more years to come into the healthcare sector, because if the original players like the governments are not changing with the times, it gives room for other interests like the tech companies to come into the healthcare system. And we see that now we have very interesting people coming into healthcare. Probably in the past, we could have not thought that these tech companies would have an interest into healthcare. And we see that they are, able to, we see that if funding only comes from government, we are not able to get enough service. Okay, we go to scenario number 3, and as I said, transformation of healthcare, it becoming more digitized is going to improve a lot of things. And one of things that is going to improve is how we deal with patients, or how patients deal with their own personal health. We see that if we have a more digitized healthcare system, people are able to access more service, because you don't necessarily need to go to a hospital. You can do it at the comfort of your home. You can get an appointment in your office. So we see that it's causing a lot of disruption in the healthcare system. And this disruption is having an impact on the business model of the healthcare system. And we see that it brings in the aspect of data being like the new currency in the healthcare system. And this data is what is now the main currency that we are going to use in our healthcare system. As we see, the companies that are coming into our healthcare system are capitalizing on data. So digital transformation simply means we are using a lot more data to be able to give a service, and a better service, and maybe to even reduce cost of healthcare services. And it also does empowers the people, or the patients, or the population, to have the power to control their own health. Because when people are empowered by having access to apps or gadgets which alert them when something is happening in their body, we see that you will go to a hospital faster, because you will be alert. I haven't slept for 5 days straight. Something must be wrong. My blood pressure is going up. So that means you do not have to wait until you're so sick to go to the hospital. So we see all these digital apps and all these things that are coming in into our healthcare system are really impacting on how we handle our health as individuals, and how the healthcare system must adjust to these new changes that are happening in our healthcare system. We also have one challenge in the digitization of the healthcare system, which is we see that adaptation of healthcare system is not so fast. Use of data, yes, we have use of data highly made in the Western countries, in Europe, in the US, some parts of the Middle East, but in other places in the third world, South America, Africa, and other parts of the of the Pacific, we see adaptation of the digitization of the healthcare system is still slow. So if we can accelerate this digitization process, we will be able to give a better service to the people. And also it is opening opportunities for the healthcare system, and opportunities for those people who are willing to quickly adopt and adjust their business models to suit the healthcare, the current times that we are in. Because definitely, if you're not digitizing your healthcare business, you're going to lag behind, and there's not going to be much progress in the future. As we can see on our slide now, we have utilization of data in various sectors, and we see that healthcare and life sciences is among the top, but still it was at about 53% in 2020. This is a number I would wish, or I'm sure most of us in the healthcare sector would wish it to accelerate further to be maybe above 70%, so that these changes are able to impact the societies and to improve our service delivery amongst our people, and also to create more efficiency in the whole system. As I mentioned earlier, the digital the disruption by technology in our healthcare system has also some other impacts. As I said, the patients, or we as a people, we are taking initiative to take care of our own health. That means our healthcare system is changing from treating diseases, because before we only went to hospital when we are really sick, when you felt, now I cannot handle this pain anymore. But now with all this access to the apps and the digital tools, we see that we are able to receive alerts when something is happening in our bodies, because I assume most of us here today have some gadget which tells you what's up with, if you have increased temperature, if your heart rate is going up or going down, or you have increased blood pressure. And I'm sure for us females, we have an app which is tracking our female reproductive system. So we see that we have access to all these tools, and that means we are able, or we are more in control of our healthcare, our health. That means we seek help first, and this whole thing changes how the healthcare system will eventually be. It will not be just for curing diseases. The healthcare system will now focus on preventing disease, so that if I know I am at risk of having a heart attack, I have all the symptoms which I got maybe from Google or from my app, I will go next to see a doctor to see how can I be helped. Do I need surgery? What kind of surgery do I need? Can we prevent this patient from having any surgery? So we see that we are coming from a place of treating diseases to a place of preventing the diseases. And this is where now we see this the tech giants coming into our healthcare system, because these are the people who are making maximum use of the data that we are giving out there. We see companies like Amazon, Google, Apple, Microsoft, not forgetting Philips, have really invested big in the healthcare system. And in these investments are coming from a place of being able to access so much data. This data has so much power that it can change how the whole, it's already changing, not say it can change, it's already changing how our healthcare systems are working. So we see the tech giants are taking advantage of where the old system failed, which was mainly the government offering healthcare system, and now are filling this gap. And their feeling of this gap has change the business models of the healthcare system. And they will continue to play a big role in the future of our healthcare system, because it is not only the big techs, there are also other startups which are coming up. Like, for example, in Saudi, there are many startups in healthcare which are coming up. And this already we see have an impact in this region. We have so many apps we are using to check what's happening. So many AI systems which the healthcare system over here is using, or the governments are using, because they're actively involved in the healthcare of the people. So we see things are changing massively. And as they continue to invest in self-monitoring apps, we see that the investments in wearables have really shot in the recent past, and they will continue to invest, though they will continue to progress, but the peak of this progress was just within 2020 and 2021. We had a high increase in the investment in the wearables, but that does not mean it will just stabilize and then eventually it's going to start increasing. So we see that the numbers in Europe and North America and globally, the numbers will continue to increase in terms of investment for self-monitoring devices in our healthcare system, which form the basis and offer the biggest data sources for the healthcare system. As we said, when we come to the consumer-driven healthcare, on this area, I want to emphasize on the role of insurance. We see that before, the insurance companies were very rigid on the service that they offered the people or their patients or the subscribers of their products. But with the incoming of all these apps and digitization of healthcare, and having empowered customers who are us now, who are purchasers of their products, which are premiums, we are much more aware of our health. We are not assuming because probably I am of a certain age, I am more predisposed to a certain number of diseases. Maybe more likely I could get lifestyle diseases, more likely I could get fractures, all these things. Yes, we have a predisposition, but being able to be aware of really what's happening in your body by just looking at advice also makes the insurance industry it has to change with the times. Because if I'm aware, I am, for example, I'm 50 years old today, I'm suffering maybe back pain, prone to fractures. When I go to the healthcare provider, they will check my data because I have it all. And they are able to advise the insurance companies, this patient is 50 years old, but this is their current health status. The more fit and more healthy we are, because we are monitoring and doing something to keep us healthy, also has an impact on the premiums that we will pay. Because if you are more sick, if you have lifestyle diseases and you are 50 years old, of course you will have higher premiums. But if you do not have all these preconditions when you go for to take your insurance, of course you'll face a lower premium because they're not expecting to pay for sudden sickness. Maybe I'd be admitted for a diabetic foot or something, or some condition associated with my underlying condition. So we see that the changes, the digital changes and use of apps and uptake of insurance is really coming in together, and it's not something we can ignore. It is something we need to look at, and something the industry must also reinvent itself to be able to suit the needs of the people. Even if we still have challenges with younger people having lifestyle diseases, but still for the older generation, it was like, this is it, you must have all these diseases, because nobody could tell, you could not self-monitor on what's happening in your body. So we also look at what having all this data means. How can we use all this data? Because if, for example, I have my own data and I keep it to myself and I'm not sharing with anybody, how does it help me as a patient, for one? How accessible are my health records to anybody who is providing healthcare services to me? So we see that health records and data must be well connected, and this data must be shared among our service providers so that our data is accessible to everybody, so that nobody just keeps this data, which is something which happens a lot in our healthcare system. So a time should come that, for example, if I am seeking treatment in a government facility, that means if I go to Hospital Z and it's a government facility, they should be able to access my data so that they do not have to do all the tests all over again, and the whole process. Sometimes some of the tests may not be pleasant to the patient. So having a platform or a cloud where we can share all these patient each patient's data and it's accessible to the health providers is very, very important for the patient. And also it gives more coordinated treatment, and there's proper follow-up for the patient. Another thing is that we see that these tech giants are also investing a lot in data, and they're using the data maybe to create algorithms for diagnosis, and later we'll have a discussion about this. And the data that we have from our gadgets, when we look into the future, when, for example, we have the telehealth and you have to put all your data maybe in your smartwatch or on a platform that we have, all this data is now available to maybe to the public, but of course it's decoded. They will not know it's Nancy. It's just data for a patient, and this data will also help us in research and making proper diagnosis in the future and seeing the patterns that are happening within our societies or within our population. So we see two other scenarios about this race to do with data and digital transformations. We see that one I have already discussed, which we are addressing the consumer markets. What opportunities are there in the consumer markets? This is a huge market, which can be explored. And lately I have been looking at the femitech. A lot of things are happening in the femitech industries, because for a long time, the female health was not focused on so keenly. It was something that was not talked about. And this whole setup of the female care was not given a priority. But we see now, with this coming of the femitech, we have so many apps which are helping females to be able to track their own bodies. And this gives them power to be able to know what's going on with me, what should I do? If I see this change, it could be like this. So we see that this consumer-driven markets are very, very, they are huge markets which we can explore further. And femitech is something which is changing the care for the females and the care for the female healthcare and all gynecological issues associated with females. And also it's creating for many companies, many companies which were not looking at it before, and the interests were not about this. So we see that the consumers are creating so much interest in their own health. They are demanding for services. They are looking for services. And once these companies are able to identify what do the population want, what are the people looking at, what is trending now, what are the challenges in our population, and this is where the market is, because the consumer is willing to pay for this extra service that they are getting. It's not something that is mandatory, like maybe, for example, you must have insurance. No, this is something available to you, and you can use it anytime. It's at your disposal, and you're paying for it. So something you pay is, you will use it because you feel you need it, and it's serving you your certain interest. And this also goes to the use of data. How can we use the data that we are receiving? For example, for all the tech companies, how are they using the data? They're using the data for marketing, and this data is also being used by decision makers to plan for the future of healthcare. So the key is here is to make the data that we are receiving a source of revenue for many companies, or many, let me say, most tech companies are using data as a source of income, and they are cashing on it, and it will continue because we are giving more and more data, even sometimes without knowing we are giving so much of our data. So these are the two areas we see that the tech giants are focusing on, or the upcoming startups are also focusing on: consumer-driven and monetization of data. This is somewhere we cannot go wrong in this industry. Then something that data leads us to the future of healthcare, AI application. We are using AI to get diagnosis, for treatment, and we see different regions are producing their own AI functionalities to be able to provide a service to the people or to move further in their business model. So looking at it from a perspective of which region is leading in AI. Is it China? Is it America? Is it Europe? And why are they going this way? See that one of the challenges we have with AI applications, for example, is the data policies. For example, Europe has very strict data policies compared to other regions, for example, like America or China. And if China has access to so much data and it's making all these algorithms maybe for diagnosis or for various treatments, and they use, for example, their population, or let's say the population in Asia, they will make an AI algorithm which may not entirely work for everybody else in the globe, because okay, we are all same, but some things are quite different, and the AI may not be able to detect these differences which are there. So we see that the regions which are having so much data, so the access is China and America. And these are the people who are able to push forward the changes in the healthcare system. So whatever is happening in China in terms of AI will definitely impact the rest of the world, because they will use their population, they will use access to a big market to be able to bring it forth to everybody else. And this is something I am looking into, maybe for the next paper we are going to do, is the future of AI applications. Who are going to be the leaders of this race? Because it looks like a race between China and the Americans. So if anybody in our audience has an interest in this, I would be happy to be able to talk to them after this webinar about the future of AI applications in our healthcare system. Another thing that the whole idea of AI and in our healthcare system and how we are using it is something like epigenetics. Epigenetics is helping us to apply preventative medicine. Let me put it that way. Because when we are able to study our genetics, we know what we are predisposed to. And we can also formulate treatment plans for you, just for you as an individual. For example, if I'm exposed maybe to multiple sclerosis and I am genetically exposed to this, with the study of epigenetics, we see that we can be able, one, to get proper treatment, or to be able to study further to see how we can improve outcome for my condition or for anybody having this condition. Number two, it's going to prevent so many other things that could go wrong. For example, we have situations where close family members, for example, it's allowed for them, for example, to marry and have children. But we see that in this kind of arrangements, often we have children who are born with challenges, or they are exposed, so much exposed, because the genetic makeup of both parents is very closely related. So we see that the study through epigenetics will help these couples to be able to decide whether it's right for them to have children or no, or is it right for them to get married with the purpose of having children, or they can decide maybe not to have children, or they will know what kind of diseases they are predisposed to. So we see that epigenetics is playing a very big part in treatment and prevention of diseases, especially genetic diseases. And we see these studies are helping a lot, especially in a region like the Middle East, where we have interfamily marriages, maybe second cousin, first cousin. So we see that they have now doing aggressive studies on their population and their genetics, so that they can prevent this danger or this challenge of having children born with a disability, and it becomes also an expense for the government and emotionally draining for the families of the people who are affected by the diseases. For example, we have in Qatar, we have the Qatar Foundation. They are working on a project called the Qatar Genome Project, where they're studying their population, doing a genetic profile, and anybody who with the intention of getting married must undergo through this process. And this is helping them make better decisions about their own care. And also we see that AI is playing a big role in this study. And this is not only exclusive to the Qatar Foundation project. We see that it is replicated, like in all the GCC countries, they have a program like this. They do the genetic study. It's very interesting, and the results are amazing, because also it empowers the population. And then one of the final things I would like us to look at is the nature on the role of nature in our healthcare system. We have talked so much about digitization, we've talking about AI, but what role does nature have to play, and does it have any impact on our healthcare system? We see that with all these improvements in technology, nature still has a big role in our healthcare system. And we see that we have continued to use, let's say, mice to do our studies. And of course, there are studies now happening that we can be able to do without using the animals, because animals also do not deserve to be our guinea pigs forever. So we see that we need to also look at how nature can help us support our health, and how digitization can be connected with nature to improve our healthcare. So, for example, I have an example of a university in France which did research on giving diagnosis for cancer. And we see that they did a long study and used ants to be able to detect any cancer cells. And this is amazing, because all the time we think we must use some high-tech devices to detect cancer, or we must use complicated AI system or platforms to be able to get a diagnosis, or high-tech devices. But we see that something we see every day in our lives. For example, the ants. Someone noticed they can offer something, and they are easily available. It's cheap to answer there, unless we killed all of them. But we see that this is a classical case of how nature can help us improve our diagnostics without, and now combining it with all the digitization that's happening. But there is also a case of one Scottish lady who is able to diagnose or to sense Parkinson's disease. And Of course, this is not common. It doesn't happen to all of us, but it happened to her because she had an abnormality or something which is not found in most of us. So you see that she's able to smell the cells or the Parkinson's disease cells. Initially, of course, nobody believed it, but with a lot of studies which were done at the University of Manchester for a long time, it has now been proven that she can actually smell Parkinson's. So, and many other things which are currently happening in our research labs to prove that nature combined with digitization can improve outcome of our healthcare system. So we can, as much as we continue to advance technologically, we must also be able to reflect back on where we came from. What does nature have to offer us, and how can we improve what nature is offering us through digitization, through AI, to improve outcomes of health, not just for the healthcare system, but for us and as individuals, and also for scientists and researchers to be able to provide a better service to the people. So, so basically, that's an outlook of our horizon. It's much more detailed in the original document. So this is just an overview of what we can find in our document. So I will, if you have any questions, I will answer them now.
Here from Switzerland. Can you hear me?
No.
Yes.
Yes.
Yes,
okay.
now I can.
Okay, hi. Hey, Shukran, thank you very much for this presentation. I have looked at it with some expectations. I've done the same thing in 2017, basically predicting and basically saying what's going to happen in 2020 and beyond. As you have already said, it's all about data. Data is the new gold to start with. Actually, the big question is who's the owner? Who's the owner of the data? Because we are all patients, and we are all giving our data for free, and all of these big tech companies are basically monetizing and earning money on our data. Now, healthcare should be something that should be free for everyone. It doesn't matter from where you're coming from, whether you're poor or rich. We should share that data in basically to help humanity survive. All the things that we're going to get. Now, looking at the AI part, and I've been in the IT for 30 years now. I've seen IT start from zero to now what it is, and even bursted. There are a few things that we need to watch out for. Number one, data is new gold. Data is very prone to, let's say, hacking. So you can get hacks on your medical data, which has happened in the past week with a company in Australia. And security is something that we should have to look at from the beginning. So if we look at the entire value chain, you'll see that it's not only the insurance company, you have the physicians, you have the laboratories, you even have the pharmacies who are basically part of this ecosystem. And then within the healthcare system, you also have healthcare devices. My question is that if you're going to use AI and ML to do the predictalytics, which means predictive analytics, you should also have something to encapsulate and encrypt your data, in which the blockchain technology could be one of the ways to move forward. Did you guys do a study on that, or have you looked into that on how do you combine AI, ML, blockchain, and then to create some kind of secured ecosystem of which life sciences can use that data to do the whole manufacturing, the clinical trial, do the whole FDA process, and then basically move it over also to the healthcare devices, because at this moment, I do think even in Africa, they do have a mobile phone to do payments. And actually with a mobile phone and a mobile app and a mobile device, it would be able to connect everyone to this ecosystem and have the data secure and also be sharing the data among all the companies in the world. Have you guys done a research on that? Is my question. And I'm not talking
No,
for a company here. I'm talking for
no, no.
myself and me. So, to make that clear.
Well, thank you very much.
Pardon, I probably can step in here.
Yeah,
I'm
go ahead.
not sure about the research, but we are just have taken care of a customer which has a solution exactly in that field. It's an AI company. They have a solution for digital pathology, and they use the problem of data security that with a blockchain, that they're going down to get the data, but leave the personal data on the place it is, so on the hospitals, on the research center, whatsoever. But they take the data up and the knowledge, and they share it. And of course, there's an environment with algorithm behind it that you can use it. Is that for everybody? Well, it's of course a payable service, you know. I mean,
I know it's a payable
whether,
service.
Whether there is an environment, does anybody gives data for free, even in the healthcare system? That's, I mean, that would be nice, but that probably will be happen because
No. Precise.
Economic-wise, you have to invest, and if you invest, you want to get money back, and that's the point. But there is it's a very interesting solution there. We are in the fundraising process for this customer in digital pathology, and I think they have solved this problem, and it's a nice solution. I'm not sure whether we made the study overall, but in that deepness of that customer, we have a solution.
Okay, because I have not seen it yet. Actually, I'm seeing them all are on one position. They're not looking at the entire value chain in this case, and that's the problem. Actually, it's a value chain. Healthcare, life sciences.
This is exactly the value chain, because they look at pictures, then the research on the you have a report, then it goes to the doctor. The doctor makes a treatment decision. It goes to the patient, which comes back with say, well, it was great, or it doesn't happen anything, or it got even worse. And the know-how of that decision is shareable. You know, it's not only the doctor in any cities or in, for example, University Hospital in Zurich can use it. So it's also anybody in Australia, in South America, in Africa can use this knowledge without having access to the real patient's data. You know? We only need that you are a woman, blood group, age, you know, the thing.
The same.
Whatsoever. So the relevant topic of DNA, but not the data itself. It's not needed, just the know-how. And the algorithm does the process and keeps the data safe in the place it is. You know, and of course there is usually for the first 1,000 data sets you pay a bit more. For the data set 100,000 to 1 million, it's not that worse anymore, you know. So it's
true.
Pricing calculation in that value. Huh? Okay.
True. Agree. Thank you for the answer.
Good.
Okay. So I don't know if anyone else has any other question about the presentation or about the digitization of healthcare. We have sent you in the chat the link to the research paper. If you want to access it, all the information and even more information that was talked about during this meeting is there, so you can access it. And if you have any questions, well, you can contact directly to Nancy in her email, nancy.muya@leverageexperts.com. I forgot the name of the dash, the line. And yeah, or you can contact us at info.leverageexperts.com, and we can help you with anything you would need. I don't know if Heinz, do you want to add anything else?
No, I think this is pretty fine, you know. So I think it's just the research. We also have some customers and process. I think I spoke a lot with investors, users, opponents of this specific environment. There's a lot of happening, but that you bring it down to earth. This is still the issues, you know, and the investor part have to exactly know where the journey is going to. but there is some solution in AI with blockchain, with federated learning. So it's a lot of technology around there, but not all the solutions there are really usable for an environment in a big one. So just solving a very specific problem, and that's probably also good, but to help the healthcare system, it needs a bit a broader view on the topic, which we try to do with this research. Thanks you.
Okay, I think we have Nancy back because she had a little technical problem. Nancy, if you want to add anything else to end, go ahead, please.
Yeah, sorry about that. We had a little power surge in the building. So in regard to our discussion today, as Alejandra said, we deal with transformation, and we are happy to offer anybody who has interest in our product. We will offer a half-day workshop on transformation of your business model to suit the changes that are happening currently. And we have all the professionals to support you. We have Heinz and his team, and they will prepare for a workshop for your team, for your managers, for your CEO, and they will guide you, and you will have a whole day discussion and look at your markets of interests. Where are you at now? Where are you aiming to be in the future? How can adaptation of technology improve the outcome of your business or lead you to the next level of your business? So to get all this information, feel free to contact us. I will add my email on the chat, and of course we'll send you a follow-up email on the same. And also, as I mentioned earlier, if someone has an interest in the future of AI, it's something I'm looking into. And if somebody is doing a study or is working on a paper, I will be happy to collaborate, and Leverage experts will be happy to be part of the work. Yeah, we hope to do a paper on the same.
Okay, perfect. So thank you, everyone. You have all the information in the chat. I just left you also, well, my team left also the email for Nancy and her LinkedIn if you want to contact her through there. Or you have also the website for Leverage Experts, and you can find more information about this half-day workshop that Nancy mentioned. Thank you, everyone, for joining. And yeah, if you have any questions, please don't doubt to send us via email. Goodbye.
Goodbye. Thank you very much.
Thank
Have a nice
you
day.
very much.
Bye-bye.
Thanks. Bye-bye.